Welcome learners. Today we are going to talk about cranial nerves. It is a big topic, so I'm going to divide into several lectures. So today we are going to only talk about introduction and a little bit about summary. So cranial nerves, as we all know, there are 12 in pairs. Different names are given according to Roman numbers. They are given. Functionally, they are different, and their arising area or existing area from cranial is separate. So all these are going to be summarized in this topic. So let's start the topic. So first of all, little bit introduction. Cranial nerves are the means by which the brain receive information from the control and controls the activities of the head and neck, and to the lesser extent to the thoracic and abdominal pressure. So basically these nerves are going to control the systems of head and neck region, but some of them like vagus, it goes till the abdominal regions also. The PNS, that is peripheral nervous system, is comprised of spinal and cranial nerve. So cranial nerve is actually the part of peripheral nervous system, not the central nervous system. It should be very much clear. The Roman anatomist Galen first identified the cranial nerves in the 2nd century AD. Although he did not identify all of them, he considered the cranial nerves to be the hollow and to distribute the animal spirits. As we already know, cranial nerves are 12 pairs that arise directly from the brain. The first two nerves, that is olfactory and optic, arise from the cerebrum, and rest all, it is 10, are arising going to arise from brainstem from different areas. They are individually named and numbered. Roman numbers are given here in retrocostal sequence. Unlike the spinal nerves, only some cranial nerves are mixed in the function, carrying both sensory and motor fibers. As we already know, spinal nerves are all mixed nerves. The names of cranial nerves relate to their function as well as their location of exit from the cranium. So let's see the origin of cranial nerve first. The olfactory nerve, that is one, and optic nerve, that is second nerve, originate from the cerebrum directly. Rest all, that is cranial nerve from 12 to 12, are arising from brainstem. They can arise from a specific part of brainstem, that is from midbrain, pons, or medulla, or from the junction between these two parts. So here we can comprise it. From midbrain, the trochlear nerve comes from the posterior side of the midbrain. Uh, Important note is that it has the longest intracranial nerve length of all cranial nerves. Intracranial length we are talking about. Midbrain and pontine junction, it is oculomotor, that is third. From pons, it is trigeminal, fifth. Pontine and medulla junction, it is 6 to 8, that is abducens, facial and vestibulocochlear, that is auditory nerve. And from medulla oblongata, posterior to the olive, will be the glossopharyngeal, vagus, and accessory, that is 9, 10, and 11. And anterior to olive, it will be the hypoglossal. So here these are some important points to be remembered that origin of cranial nerves other than first two. So it will be from brainstem and its junctions. So this we have to remember. So this is a diagram which says the location of cranial nerves on the cerebrum and brainstem. So from here also you can see olfactory and optic both will be from the part of cerebrum, and rest will be from the brainstem and its several junctions. So now we are going to talk about order of exit from the cranium, which will be anterior to posterior. We are going to talk about. So as we all know, these are going to exit from different foramina and canals. The cranial nerve with the number 2, those who are having number 2, that is second and 12th, that is optic nerve and hypoglossal nerve, will exit from canal. The rest all will be from foramens. So we'll see in the next diagram how they are going to get exit. So this is the important tip, that those who are having 2 in their self, they will be from canal. So it will be optic canal and hypoglossal canal. So from this diagram we can summarize the first cranial nerve, that is olfactory nerve, will be coming from the cribriform plate. Optic canal will give the exit to the optic nerve, as we have already said. The important thing is superior optic orbital fissure, which is going to give to exit to the 4 of them: oculomotor nerve, trochlear nerve, ophthalmic nerve, which is the first part of trigeminal nerve, and abducent nerve. Foramen rotundum will give exit to the maxillary nerve, which is the second part of the trigeminal nerve. Foramen ovale is going to give to the exit to the mandibular nerve, which is the third part of trigeminal nerve. Internal acoustic meatus will give exit to the facial nerve and vestibulocochlear nerve, that is 7th and 8th. Jugular foramen will give exit to the glossopharyngeal, vagus, and accessory nerve. and the last will be the again the nerve having two in it, that is hypoglossal canal will give exit to the hypoglossal nerve. So this is the exit point of the 12 cranial nerves. Now, modalities or types. So this is very important to understand what functionally they are going to do. So you see, simply each cranial nerve can be described in sensory, motor, or mixed, or both. Here we are going to use the term both. They can more specifically transmit 7 types of information. 3 of them are very unique to cranial nerves only: SSS, SVS, and SVM. We are going to talk about in detail also. So first of all, we are going to see the sensory or afferent modalities. The first one is general somatic sensory type. They will carry general sensation from skin. So we are going to abbreviate it as GSS. Then there will be general visceral sensory GVS, that is general sensation from different viscera, that is organs. Then there is spatial somatic sensory SSS, senses derived from ectoderm. So things which are derived from ectoderm actually they will be taken by this particular type, that is SSS. Then there is spatial visceral sensory, the senses derived from endoderm. The specific senses like taste and smell will be from this particular SVS type. So sensory modalities are 4 types: general somatic sensory, general visceral sensory, spatial somatic sensory, spatial visceral sensory. The point which is given in the next part, or the thing like general sensation from skin, general sensation from viscera, from ectoderm, endoderm. This point you have to remember so that it will be easy for you to remember the functions. Then there are 3 motor efferent modalities, that is general somatic motor, that is from skeletal muscles; general visceral motor, that is from autonomic and gut, that is smooth muscles; then spatial visceral motor, that is muscles derived from the pharyngeal arches. So these 3 modalities are given for the motor. Now we are going to summarize the all cranial nerves, that is 12 pair, in the heading number, name, exit, modality, and function. Function and modality you have to be very much clear in your mind. The first one is cranial nerve number 1. Everybody knows this is olfactory nerve. The exit point is cribriform plate. Modality it is sensory types SVS. SVS means spatial visceral sensory. The function will be smell. Then second one is optic nerve. Exit point is optic canal. This is also a sensory one, but it is SSS, that is spatial somatic sensory, and here it is for the vision. Next one is cranial nerve number 3, that is oculomotor. The exit point is superior orbital fissure. This is of motor type by having 2 modalities, GSM and GVM. GSM in general somatic motor and general visceral motor. So from general somatic motor part, 4 extrinsic eye muscles and levator palpebrae superioris is going to be controlled. So these are extraocular muscles. You might be knowing extrinsic muscles, levator, LPS, and all this is. Then there is GVM, that is general visceral motor. These are going to control the pupillary sphincters. Next, fourth one is trochlear nerve. This is also going to get exit from the superior orbital fissure. This is a motor type, and it is going to control or do the function of superior oblique muscles. Next one is fifth one, trigeminal. It itself has 3 parts: ophthalmic, maxillary, and mandibular. All 3 are coming from the different exits. Ophthalmic will come from superior orbital fissure. It is GSS. Its function is will be towards the giving the innervation to the scalp, forehead, and nose. Maxillary will exit from foramen rotundum. GSS, it will give the sensation to the cheeks, lower eye eyelid, nasal mucosa, upper lip, upper teeth, and palate. And third one is mandibular, which comes from foramen ovale. It will be GSS and SBM. GSS part will give anterior 2/3 of the tongue, skin over the mandible and lower teeth, and SBM to the muscles of mastication. So it's very simple to remember if you keep your hand like this, 3 fingers. So towards the orbital fissure, it will be ophthalmic. In the cheeks, it will be maxillary. Toward the mandible, it will be the mandibular. And so are the innervation points. So this is about the trigeminal. Next is sixth one, that is abduction. It also get exit from superior orbital fissure. It is of motor type, GSM modality. It innervates lateral rectus. Then there is seventh one, facial. exit point to internal acoustic meatus through stylomastoid foramen. It is mixed type or bone type and has four modalities. GSS, it gives sensation to the part of external ear. SVS, it tastes from the anterior two-thirds of the tongue, hard and soft palate. SVM, innervates muscles of the facial expression. GVM, lacrimal, mandibular, sublingual glands and mucous glands of the mouth and nose. So you should remember modality, then the function remembering will be very easy. Next, the eighth one is vestibulocochlear, commonly called as auditory. Its axis point in internal acoustic meatus. It is a sensory type. Hearing and balance are the functioning of it. Vestibular part for balance, cochlear part for hearing. Then there is glossopharyngeal, the ninth one. The exit point is jugular foramen. It has many modalities like GSS. Through GSS, posterior one-third of the tongue, external ear, and middle ear cavity are innervated. GVS gives supplies to the carotid body and sinus. SVS takes from the posterior one-third of the tongue. GVM parotid gland, SVM stylopharyngeus muscles. So this is the for the ninth cranial nerve, that is glossopharyngeal nerve. Tenth one is vagus. Exit point is jugular foramen. Many modalities like GSS. The function is external ear, larynx and pharynx. GVS, larynx, pharynx and thoracic and abdominal viscera. So see, this one goes to the abdominal viscera. Then SVS, that is sensory, taste from the epiglottis region of the tongue. GVM, that is motor part. It will be smooth muscles of the pharynx, larynx, and most of the GIT. It is autonomic nervous system. Then SVM, most muscles of the pharynx and larynx. To see, sensory part will give something sensation or taste or smell, something like this. Motor part will control the muscles. Remember it. 11th one is spinal accessory. Exit is from jugular foramen. Its motor type GSM, trapezius and sternocleidomastoid, and SVM. A few fibers run with the cranial nerve number 10, that is vagus, to the viscera. So remember, trapezius and sternocleidomastoid muscles of the neck region superior most are actually innervated by the cranial nerve. This is very important question. Next one is hypoglossal. Exit point is again canal because 2 is there. So hypoglossal canal. It's a motor type GSM, intrinsic and extrinsic tongue muscles except palatoglossus. So this is the summary of the all the cranial nerves in a very short format. Just the thing which you have to remember is modality. If you remember the modality, function remembering will be very easy, and it will be when we are going to talk about each of the nerves separately in detail in further lectures, it will be easy for you to grasp it. So that's all from this side. You can check the diagram from here also. A prostrated diagram is given of nerves, of all the nerves. So you can check it from here. So that's all from this side. Thank you.